Herpes viruses are a large group of double-stranded DNA viruses that have an envelope. So this is different from the other double-stranded DNA viruses we've talked about. Herpes viruses are super common, and they can establish both latent and recurrent infections. And there are even some that can cause cancers. They can encode many proteins that will manipulate the cell and immune response. They have their own DNA polymerase that promotes their DNA replication, but at the same time makes that an attractive target for antiviral drugs. They are released because they are enveloped. They can be released by exocytosis or through budding. They can also be released by cell lysis. And sometimes they can even pass from cell to cell through bridges. They can cause lytic, persistent, and latent infections. And again, for Epstein-Barr, they can cause cancer. They are found everywhere in lots of different cell types. And unlike some of the other double-stranded DNA viruses we talked about where antibody is really important, because these are enveloped, cell-mediated immunity is more important for control. There are a number of different human herpes viruses, and there are lots of herpes viruses in other animals as well. Sometimes the herpes viruses from other animals can actually be fatal to humans, so particularly people who work with primates have to be very careful. Generally, when we think of herpes viruses, most people probably think of things like herpes simplex 1 and 2, oral and genital herpes, but we also have chickenpox, mono, cytomegalovirus, and others. We're not going to talk about all 8 of these listed here. We're going to talk about 5 of them. This is what herpes viruses look like under an electron micrograph. You can see the envelope surrounding the capsid with the nucleic acid core. Here it is as a cartoon, viral glycoproteins, the cell envelope, the capsid, and the DNA in the middle. Depending on the herpes virus, they will exhibit tissue tropism, so they go to different tissues depending on which virus it is. The transcription of herpes viruses has 3 phases. Immediate early is when transcription of viral DNA begins and also takeover of the host cell. Early includes more transcription factors and other enzymes like their DNA polymerase for replication. And then late is when they start to make their structural proteins. When you have a situation where the genes are being expressed, but we're not replicating the genome, that's when you have latent infections. And herpes viruses, specifically the ones that cause herpes simplex and chickenpox, generally are going to be latent in neurons. So for herpes simplex viruses, we're really going to talk about 1 and 2 at the same time because they can kind of be interchangeable in the types of symptoms they cause. Herpes means to creep. These are viruses that kind of appear and then disappear. Unlike other viruses, the herpes viruses have a lot of unique proteins, and because of that, that can provide good drug targets. So this virus has 80 proteins. Remember, we can contrast that with the HPV, which has only 8. 8 early and then 2 late. So it has a lot more proteins, and that provides more opportunity to target the infections. They can infect, the herpes simplex viruses 1 and 2 can infect most human cell types. Depending on the type of cell that's infected, you may see a lytic versus a latent infection. Herpes simplex 2 is more likely to leave the localized area and cause viremia. Both herpes simplex viruses cause lytic infection of most cells, but latent infection in neurons. So they hide out in the neurons, but then when they get in, for example, skin cells, that's when you get the lytic infection. The cell lysis comes from mostly inhibition of the host cell macromolecules. So basically it stops the host cell from being able to replicate because the virus is replicating itself. And eventually when the host cell isn't able to replicate or to repair any damage, the cell will lyse. If you do a biopsy of some of these lesions, you may see inclusion bodies in the nucleus. So these kind of dense collections of viral DNA, and also syncytia. They'll form those giant multinucleated cells. When you have these lesions, the lesions are caused by a combination of viral pathology, so the virus can be causing the cell to lyse, or host pathology. The immune response causes the host cells to lyse. And these tend to be fluid-filled blisters. These are cold sores. Cold sores are caused by herpes simplex virus. The fluid will contain virions, infectious particles. But remember, because they are enveloped, if they start to dry out, they can lose their infectivity. So if they're very, very wet still, that can lead to transmission. So CD8 positive T cells, so like killer, basically cytotoxic T cells, and interferon gamma are important for maintaining latency because these cells and then this particular cytokine help get rid of cells that are expressing the virus. So if a cell is just holding on to the virus but not expressing viral proteins, that's going to be a latent stage. The virus will hide out in the neurons, like I mentioned earlier, and then you'll get recurrence of symptoms, so the lesion formation, at the initial infection site. So if this was originally an oral infection, like a cold sore, they'll hide up here in the neurons in the face, and then you'll get the cold sore to come back at the original site. So this is generally acquired by something like kissing, or less commonly like sharing utensils or like cups with somebody who has an active infection. But usually this is acquired from kissing. What triggers a recurrence? So when you have the initial infection, you're going to have the lesions. The lesions will go away, but what causes them to come back? Lots of things. Ultraviolet radiation, so skiing or tanning, fever, which is why they sometimes call them fever blister, emotional stress, so finals, a big date, which, really sucks. You're going to go on a big date, you're a little bit nervous, under emotional stress, and then you get a cold sore. That's not really going to help. Physical stress, so irritation, menstruation, spicy food, immune suppression. So lots of things basically can trigger these viruses to come back. Now, the problem with latency is that it leads to the potential for lifelong transmission. The virus can persist in your body as long as your body is still alive, and that means you can potentially spread the virus during that time. Luckily, the envelope does make it sensitive to inactivation, so you're less likely to get it from surfaces because it could dry out pretty rapidly. The virus is transmitted in saliva, vaginal secretions, contact with lesion fluid, so the mixing and matching of mucous membranes, which is generally why we think of it as being transmitted through things like kissing or through sexual contact. The virus can be transmitted orally and sexually, of course, but it can also get into eyes or breaks in the skin. Less common, but possible. Herpes simplex 1 is the one that we think of generally as oral herpes, whereas herpes simplex virus 2 is the one we typically think of as genital herpes, but that is not exclusive. Herpes simplex 1 can cause genital lesions, and herpes simplex 2 can cause oral lesions. So both types can cause oral and genital lesions, but we tend to see one transmitted orally and 2 transmitted sexually. And remember, 2 is also the one that is more likely to cause viremia or get into the bloodstream. So who's at risk? So children are actually at risk for primary disease from herpes simplex virus 1 because kids are so cute. Everybody wants to give them kisses. So I'm not talking about that herpes simplex virus 1 is generally transmitted only through like romantic type kissing, any type of kissing. And so this is why a lot of people will recommend that you not kiss infants or newborns who have a very, very low immune system. And you shouldn't kiss children if you have any sort of active sore. Even if they're your own kids and they're so cute and you want to just give them kisses, you can't. And then, of course, sexually active people are at risk more commonly for herpes simplex virus number 2. Any healthcare professional who comes into contact with oral or genital secretions could be at risk for infections of the fingers. So if you have a break in the skin and you get the viral particles in your skin, you can get herpes lesions on your skin. Now, the major reason we don't want to kiss babies is, of course, we don't want them to have cold sores or fever blisters for the rest of their lives. But in neonates, herpes infections can be fatal. And also for immune-compromised patients. It is, however, a very, very common viral infection. It's estimated that more than 90% of people in developing areas have antibodies to herpes simplex 1 by the age of 2, meaning people were giving them kisses because they're so cute. Neonates are generally infected at childbirth, and it doesn't have to be a mother with an active infection. It could be a latent infection. The virus can even cause infection in utero. So it's very important if you've ever been diagnosed with a herpes infection and you become pregnant that you take your antiviral medication, which we'll talk about later. And again, another estimate, 20 to 25% of adults in the US are infected with herpes simplex virus 2. So this is a case describing neonatal herpes simplex virus contracted during birth. So during a breech presentation, so normally the baby's supposed to come out head first. Breech is when they come out like feet first or butt first. A fetal monitor was placed on the buttocks of the baby. And because of the greatly prolonged labor, the baby was delivered by C-section. So because the baby was breech, they couldn't get the baby to come out. So they did a C-section instead. Sometimes they'll try to flip the baby, but when babies are in that position, they can be stressed out, and to monitor them, they will actually apply a heart rate or a fetal monitor to whatever they can reach. And in this case, it was the tushy. So the 5-pound boy had minor difficulties that were successfully treated, but on the 6th day, he developed lesions with a red base at the site where the fetal monitor had been placed, so on his butt. Herpes simplex virus was grown from the vesical fluid and the spinal fluid, cornea, saliva, and blood. The baby had trouble breathing, had seizures. They started treatment with they're called nucleoside analogs. So these are basically drugs that look a lot like a nucleotide, so that when the virus is trying to replicate, it incorporates this drug into the DNA, which stops the DNA from being able to be replicated. So it's like a replication inhibitor. The baby also developed a slower heart rate and occasional vomiting. The vesicles spread and covered the lower extremities and were on the back, palms, nose, and right eyelid. With 72 hours of treatment, the condition started to improve. Treatment was continued for 11 days, but discontinued because of a low platelet count. So the thing to remember when you're thinking about, again, inhibiting viral DNA replication, yes, these drugs are incorporated and used to stop viral DNA replication, but these particular drugs can also stop host cell replication. And generally, viruses replicate more quickly than host cells. So you're basically hoping to stop the virus before you stop the host cells. But Platelets are derived from hematopoietic stem cells, which are a type of rapidly dividing cell. So that's why they had to, that's why they saw the low platelet count and then stopped treatment. The baby was discharged on the 45th day after birth, and normal development was reported at 1 to 2 years of age. After 6 weeks after the birth, a herpes lesion was found on the mother's vulva. So the mother had herpes simplex virus. The baby was successfully treated and was able to overcome the damage caused by the infection. And this is not always the outcome. The virus, most likely herpes simplex virus 2, was probably acquired through an abrasion caused by the fetal monitor when the neonate was in the birth canal. This antiviral drug has since been replaced with drugs that are better, less toxic, and easier to administer, such as acyclovir, etc. So again, this case is from the 1980s. So drugs have improved, but there are still those risks. And so one of the other things you have to think about as a healthcare professional is what patient groups might be at risk. So this is herpes cases among babies linked to ultra-Orthodox Jewish circumcision ritual. So this was in New York. There's a population of very, very observant Orthodox Jews, and one of the rituals they do surrounding circumcision is that the religious official, like the rabbi who's performing the circumcision, removes blood from the circumcision site using his mouth. And if that rabbi has herpes simplex virus, probably herpes simplex virus 1, because it's his mouth, it can then get into the open wound caused by the circumcision. And so this was causing the death of neonates in the Jewish community in New York City. So what is neonatal herpes? Parents speak of unbearable pain of watching their 13-day-old baby die. So this is when you as a physician, again, could run into cultural, religious sensitivities where you are basically asking people to change the way that they have done something for thousands of years, and that they have a deep-seated belief that they must do it this way because that's what their religious text says. So now I think they've recommended that the rabbis use like a small glass device to help, remove the blood from the area. And it may not sound like a process that you would ever think of doing. Like, of course I would never do that. But until, you think about these other people's perspectives, you have to be really cognizant and culturally competent when you're going into medicine. So I wanted you to think about these things. So the herpes simplex viruses, you can see here, can both cause very similar manifestations of disease. But again, we tend to see herpes simplex 1 associated with oral infection, and we tend to see herpes simplex 2 associated with genital infection. Neonates, again, we would most commonly see genital or herpes simplex 2 causing infections in neonates because of the exposure to the mother. However, kissing can lead to herpes simplex virus 1 life-threatening infections in neonates. So again, typically we see cold sores or fever blisters. You can have it in the throat, so herpes pharyngitis. You can have it in the eye, herpetic keratitis. Herpetic whitlow are herpes lesions on the finger. Herpes gladiatorum is on the rest of the body. So if you had a cut in the skin as an adult and you got the virus in there, that's generally what you'd see. And unfortunately, infections in neonates are often fatal. And so this is really dangerous because it's a super common infection that we have to protect neonates from. Direct analysis of clinical samples can be diagnostic. Of course, you can also test for the presence of viral antigen or viral DNA. And these nucleoside analogs can prevent or shorten outbreaks. So if you've ever been diagnosed with herpes simplex virus, or you diagnose a patient with herpes simplex virus, they're generally going to take a drug like a nucleoside analog to prevent outbreaks from happening. Washing with soap or any other type of disinfectant can disinfect the virus because it is enveloped. And if you are in the healthcare profession, you of course will want to wear some protective apparel.